Good morning. Assalamu alaikum. How's everyone doing? Hope you're doing well. The greetings of peace to everybody. Welcome to another program on your health here from ShuraTV and Genesis Medical Center. I'm Dr. Zachariah. Welcome to our program again. We hope that you're having a great day. Today is October 5th. Here we are. We've started the fall. People have started their school and colleges, and everyone's in full swing of things. And one quick update, the booster for Pfizer has been approved and people are taking it in masses. So it is recommended that if you've had your second vaccine already more than 6 to 8 months ago, you are due for a booster, especially if you're a senior or if you're immunocompromised or you're a healthcare worker. And if you're in specifically more so if you're in those states that have low vaccination rates and your ICUs are still fairly full, and there is a crush and crunch on you in terms of the first line worker. So it's important to get that booster to protect yourself. That's just a little public service announcement that we'd like to make. And all the studies and everything has shown that it increases the antibodies to COVID, and it helps with the variants as well. And the outcomes in areas where there's high vaccination rates are much better. Lower hospitalization rates, lower number of deaths. So please take that seriously and go get yourself the booster. Or if you haven't been vaccinated yet, please go and get the vaccine, because that'll help you in your long-term health here in the U.S., especially since the COVID-19 virus is still rampant and in society. Today, we wanted to discuss a little bit about intravenous immunoboost IVs. Lately, it's become very fashionable and trendy that you see a lot of facilities offering what's known as the IV drip, which means rather than taking things orally through your mouth, they give you vitamins, nutrients, amino acids, antioxidants, all these types of things. They give it through the intravenous route, meaning that they establish a vein like you would when you're taking blood from yourself. They establish a vein in your arm, most likely, and then they put the bag of nutrients and they let it drip for 20 to 35 to 40 minutes, depending on what you need. Initially, there was a lot of resistance to this, but as these facilities started popping up, especially here in California, there's a lot of these facilities in, for example, Newport Beach, Laguna Beach, Irvine, West LA, Santa Monica, Beverly Hills, all these cities, they have, and they also have a concierge IV drip where people come to your facility, your hotel, your house, wherever your dwelling is, and they give you IV nutrition and IV vitamins. And traditionally, that was done in a home health setting where those people that were ill or they had issues with their health couldn't go to the doctor's office or couldn't go to the hospital, and they would have the nurse come on a doctor's order and they would give you the IV nutrition at home. But now people are seeking it just for general health and general nutrition, and because the thinking is that there's a lot of deficiencies that we have walking around, and that we're not getting enough nutrients and good nutrition from our food sources. So people supplement. One way they supplement is through oral supplementation, which are the vitamins, the supplements that they take. There's the supplement industry is more than a $3 billion industry yearly. So people buy a lot of supplements that haven't really been evaluated by the FDA or any specific governmental or regulatory body, but people buy them because they hear about it. There's, I'm sure You've seen turmeric capsules and garlic capsules and glutathione and NAD and all types of things that are out there for general, CoQ10 for general health and for heart health, for brain health. They have specific things for anti-inflammation, for for your joints. There's a lot of things for your joints before glucosamine and all types of vitamin D's and calcium, and all these things are available in pill form. But the question is always, how much of that nutrient or that vitamin is really in the pill, and how much or the rest of it are fillers. That's one consideration. And then you have the other consideration of, how much of this really gets absorbed in the body, and how much of it are you really absorbing, and it's really giving you the benefit. That's the sort of risk benefit analysis. On the one hand, you have these expensive supplements that people recommend that you take because you have certain deficiencies or you have certain pathologies in your body. On the other hand, you don't know how much of that is really being absorbed, how much of that just goes to your waste in your body, and you just kind of pee it out with your waste. So this is the question to ask, and a lot of people, because of this kind of dilemma, they've opted for IV supplementation. Now, the IV supplementation, of course, it has to be administered and done through a medical office, and you have to be under medical supervision. If you're at an IV place and there's no doctor or RN, and they don't take a quick history and physical and ask you about your history and your health and what things you're allergic to, then I would be very wary of getting that service from that facility, because the least that they should do in a facility is to sit you down with either a doctor or a nurse practitioner, some type of MD or a nurse practitioner or a DO, and go through your physical health and a little bit of a history, so that they know that you're not allergic to anything, and they know that what are the things that are what are the issues that you have with your health. That's very important, to take a history and physical. If they're just putting in an IV right away and they're not asking you a lot of questions, then that's not the kind of facility you want to be in. So let's look at some of the benefits and the concept of why people get the IVs, right? Number one, it's the issue of your digestive system, right? When you orally take pills and supplements with your mouth, and you take it 2 or 3 times a day, you're having that supplement go through your digestive system. And there's what's known as a first pass effect, where your digestive system is actually trying to digest whatever you're taking orally. So when that happens, you have a lot of high acidic, environment in your stomach. And what that does is that churns and dissolves whatever you're eating, so that a certain percentage of it gets digested and absorbed, and the rest are going down as waste. So that's a consideration. So you're taking 2 or 3 pills. Out of that 2 or 3 pills, the studies tell us maybe a third of it will get absorbed properly, and the other 2/3 will be shed out as waste, either through urination or defecation, either way. So that's a consideration people take, because they buy these high-end vitamins that have all these claims, these supplements that make these claims. But if you're not really getting the maximum absorption of it, then there has to be a way that people try to get them the highest absorption of those nutrients and vitamins and amino acids and antioxidants. It's very important. So because of that, now people are actually looking at the IV route. The IV route, of course, intravenously, IV therapy provides, that nutrition. The one risk and consideration is that they will have to establish a way into your veins, which is usually done simply with a needle, and they do that and they establish the port. And then once they do that, they attach the drip, which is the bag, the IV bag, and they slowly infuse that bag through your uh, through your veins into your bloodstream. So when that happens, of course, you get a higher absorption of that product. Now, the contraindication or the uh, warning or what you have to be aware of is if you're a highly sensitive person, um, you might react to that IV bag. You might react to that IV. Usually they have, B12, glutathione, vitamin C, what's famously known as a Myers cocktail, which is Dr. Meyer was the one who formulated that. And it's some of the essential vitamins and nutrients that are essential for the body. So he put that all in a bag. They call it a yellow bag or a banana bag in slang. And they'll give you that for number one, hydration, and number two, for nutritional deficiencies. Has all the vitamins that you need, and it gets quickly absorbed, which is great. But provided that you're not someone who's allergic to these uh, components. So if you are someone that has known allergies, then I would be wary of getting banana bags or vitamin bags or IV bags, because we don't want that to cause you distress, right? So that's the key. You don't want that distress on your body, right? But it does provide, that quick hydration, and it provides those needed nutrients fast with good absorption. Typically, by the time you ingest some vitamins, it'll take at least, 3 to 5 hours for it to get digested and absorbed into your system. But if you're looking at a IV solution and they're putting it in right away, so you get rehydrated very quickly, and it gives you those nutrients very quickly as well. And the other benefits of IV hydration and IV route administration would be um, providing that mental and physical functionality quickly, right? A lot of people that have been known to have substance abuse, they benefit from IVs very much, immensely, because it's something where their bodies have been nutritionally deprived for a long time, and when you give them IV nutrients and IV vitamins, they quickly react, and you see the difference in them. They absorb it, and that's something where they get all the key nutrients that they've been missing for a long time. So that's very important to keep in mind. The other consideration for IV therapy is a lot of people, in terms of digestive problems and not having that appetite and not wanting to take things, they get nausea. They're very sensitive when they take oral medications or oral supplementation. So it's important for them to have that alternative route of administration, which would be the IV. And the IV therapy, of course, it helps them because they don't have that nausea and that vomiting associated with putting things in their mouth. So that's something to keep in mind. The common folks, when they go to these IV facilities, and what are they looking for? Usually, they're looking for, you know, uh, IV vitamin boost. They say, they want a vitamin boost because they feel that they're nutritionally deprived. So they'll go in and they'll say, I'm feeling very low on energy. I have a lot of lack of energy, um, low motivation. Usually, the typical the typical person that comes in and they need some, a little bit of a spunk in their step, and they usually want to get that as soon as possible. Usually, it takes about 30 minutes. Typically, all the IVs have extra vitamin C, and that provides for them that little immune boost, what they call, because a lot of people load up on 5,000 units of vitamin C daily nowadays, especially post COVID incidents. A lot of people are supplementing with vitamin C, with elderberry, with vitamin D, and then all the multivitamins they have a one a day. So they want that extra energy and they want to have that immune boost, as they call it, so that their body is functional and would fight off any type of virus or bacteria that attacks them. The other thing a lot of people come for is, again, as I mentioned, was that a lot of people are dehydrated. They don't drink enough water, so when they come to get that IV bag, they're getting rehydrated, and just that rehydration will make you feel better and more energy, and also decrease the pain and the stiffness in the joints. So it has that effect. So that's something which people are looking for. A lot of people have chronic joint pain and chronic pain in the muscles, which they'll label as fibromyalgia. So a lot of people with fibromyalgia, they come and they benefit from IV infusion therapy, and it helps them with their energy levels. It helps them with their focus and concentration, and also a lot of these folks will have sleep disturbances. A lot of people, when they get this IV and they get all the nutrients, that night that they sleep, they report a very deep sleep and a comfortable sleep. It's something which they consistently report, and also that extra bit of energy. And that's something where a lot of people are lacking currently. So they get that extra energy boost, and that's something which is um, very beneficial for them. The other thing that a lot of people get is you know we have what's known as free radicals going around our body that need to get stabilized, right? So what you do is, for free radicals, you take antioxidants, right? You hear that term a lot, and antioxidants are very important, so that your body is sort of tuned up and functioning on the biochemical level in a efficient way. So the most common IV antioxidant that people get or people read about and they ask for is glutathione. Glutathione is a antioxidant known as the mother of all antioxidants. So it's very important for the body, and it has a few benefits that we'll discuss. But it's the master antioxidant, so it's very important to get that. There's a lot of natural ways you get that from different foods that you eat, but also those foods, if they're not nutritionally dense, then you're not getting all those nutrients. Some benefits of glutathione is number one, it's very good for your liver, right? Liver health, which is very important. The liver is involved in a lot of the biochemical processes of the body, including your sugar metabolism, fat, and everything else, hormones. It's very important, and it helps with keeping your liver healthy. And what's known as fatty liver disease nowadays, a lot of people, because of the diet and lifestyle that we have here in the West, a lot of people are getting diagnosed with fatty liver. So the IV glutathione helps with that as well. It increases the levels of glutathione, and then the liver health in patients gets better as the numbers of the number of glutathione level or concentration is higher. Um, Also, in terms of the cellular activity of your body, of course, our organs and our systems in our body, are the basic building block is the cell. So glutathione is very beneficial at repairing cells. If you have damaged cells because of inflammation, because of atherosclerosis, any type of damage of cells that you have in the body, the basis is inflammation. So glutathione helps with that inflammation, and it helps in the process of what's known as um, apoptosis. So we have a lot of cellular growth, and then the growth of those cells and the repair of those cells sometimes get altered by the body, or the body loses that control, and glutathione helps reestablish that control for apoptosis and cellular growth as well. So it balances that. Also, getting back to the sugar issue, glutathione also helps with insulin sensitivity. A lot of people are insulin uh, sensitive, so that alters their blood levels of glucose. When that happens, then you have people are getting diabetes type 2, and that's getting rampant in society now, especially as society's getting kind of heavier and chubbier because of the types of foods we're eating and the sedentary lifestyle. So glutathione also helps that because higher levels of glutathione in the body are correlated with better insulin control. So insulin sensitivity is improved, and then of course it reduces what's known as oxidative stress, right? All those chronic illnesses that people have, like different autoimmune diseases like lupus and rheumatoid arthritis, these kind of things. Having good levels of glutathione in the body actually helps with those. And of course, the basis is that it decreases the inflammation. A lot of these illnesses, the basis is high inflammation. When you have a high inflammation titer in the body, and there's certain things that your doctor will look for to let you know how much inflammation you have, like C-reactive protein and things like this. They'll check on your blood tests. Once you get that result, and if you see that your glutathione levels are low, you need to take glutathione, and the best way to do it is through IV glutathione. A lot of these facilities offer it. We offer it in our facility to a Genesis Medical Center in Irvine. We offer the IV therapy as well as the glutathione boost, which is known for reducing oxidative stress, which decreases the flare-ups and symptoms from rheumatoid arthritis, lupus, any other autoimmune diseases that you might be suffering from. And of course, as we mentioned before, the other main benefit of glutathione would be IV glutathione would be that it reduces that inflammation in the body. It's important anti-inflammatory properties, and that's something to keep in mind. And if you are getting a regular IV drips from any of these facilities that you go to, you should at least once a month ask for a IV glutathione drip as well, which that'll enhance um, your experience in health. Always important, talk to your doctor personally. Have your doctor check your blood levels for these things. It's important. They usually won't do it unless you ask for it. You could always ask for vitamin levels. They tell you vitamin D is deficient nowadays. It's becoming very trendy and common. They'll check your vitamin D levels. But in general, it's important for you to keep in mind that when you're with your doctor, you are the advocate for your health. So you need to become, number one, aware and educated about these issues so that you know what's going on in your body. And then secondly, that you advocate and you talk to your doctor about it. And third, that you seek treatments that are the least harmful to you with the least side effects. So these things are important. And IV hydration and IV immune boosts and IV nutrients and vitamins is one way that you can improve your health. It's one way, and it's fortunately a quick way, and it's becoming more trendy and common. And I think even Medicare for seniors are starting to approve certain IV therapies. So that's important to keep in mind. Talk to your doctor about it. Ask them how things are in terms of your own deficiencies in vitamins and nutrients, and ask specifically for glutathione and these levels, and see what they can tell you. And usually, if you have poor liver health, then it's an indicator that you don't have these nutrients at sufficient levels, or that you're leading a lifestyle which is not conducive to healthy organ life, meaning that your organs are deteriorating because you are not getting enough of the good nutrients and the good nutrition, as opposed to getting the processed foods and not getting enough exercise. So it's important to balance that out. Again, that was a little bit about IV hydration and IV nutrients. It's important. They're absorbed in the body quicker. It bypasses the first pass effect of the digestive system, and you get results much quicker if you do things IV. It's also good for people who are suffering from substance abuse, as a lot of them are nutritionally deficient. they'll come in and they'll get IV nutrients every 1 or 2 weeks just to keep their body up to normal levels. If you do get IV hydration and IV nutrients and vitamins, there's no need to get oral supplementation. So you could stop popping those pills that you take every day, in terms of the pills that are supplements, not the pills that are prescribed by your doctor. If you are prescribed a lot of medications by your doctor, it's important that every 3 months you review them and you discuss it with your doctor whether or not those medications are still necessary for you to take. It's important for you to advocate for yourself, especially if you're a senior. Take one of your younger relatives with you so they can advocate for you and talk to your doctor about which medications you're on and why you're on them. And that's about it for today. I thank you for attending. If you have any questions or comments or concerns, please post them in the comment section, and we'll see you next week. Thank you for attending, and have a great week.